Hello everyone, it's Monday. Once again, thanks for watching. We've all had to adapt, we've all had to change, and there's just some things that we tend to have a hard time getting used to. I know every day when I see 3 college-age students at my house taking college courses in front of their computers, it just still feels strange to me. I also know that it feels strange to hear people talking about having Zoom dinners, where they're having dinner with members of their family or others while they're in their homes and their loved ones are somewhere else, and they're conversing through this technology. And heck, some of the people that we know used to get together for wine every Friday afternoon are now doing it through Zoom. I guess my point here is that we've all been forced and faced with doing things differently just to try to stay connected as best we can. And while this is difficult, it's very good from some angles because it's forcing us to rethink how we deliver care. If you'll go back to September of 2019, our strategic plan very specifically talked about the need for us as an organization to embrace virtual care. You see it right in the middle of our depiction of how our strategic plan works out. You can see virtual care right there with face-to-face care. We were anticipating that we needed to really develop this modem, this way of communicating with our patients in a virtual way even back then. Now, we had no idea that the need or necessity was going to escalate to where it has, but fortunately, Mary Jo Bean and our strategic planning department were looking into the future, and also we had great support from Steve Reedy and IT to get this platform ready for us to use, and obviously Joe Flynn and all the wonderful folks in NMG who really are helping deliver this virtual care had stepped up. So we had a great platform because we actually needed this platform much sooner than we anticipated that we would. If you just look at last week, we were able to do 4,600 visits virtually, meaning through telemedicine, through e-visits that typically would have been coming to our physicians' offices. So think about that. 4,600 people we still were able to connect with. We still were able to make sure that their care was delivered, but we didn't risk their health or our health, or importantly, the community's health, by having them come, because right now we know that that community spread is such that it could be passed in any sort of interaction that we have. So a big salute to everyone who has helped push that virtual care, that telehealth, that whole platform of us being able to stay connected with our patients during this time. And who knows, we may find a positive from this, that we're able to help people in other parts of the state that typically had to drive 3 hours for an appointment. Maybe now we'll be able to use this technology to better serve them and be more convenient and let them stay closer to home for their physician office visit and for other types of procedures that they may need. So it's one of those things where we're all adapting. There's good parts of it, there's bad parts of it, but as I always say in healthcare, we're the ones who are willing to innovate to make sure that the patient is always served. So thank you. Thanks everybody for putting together all of those wonderful tools that we have. So let's talk about numbers. So far at Norton Healthcare, we've served 308 patients who have tested positive. That's up 14 from yesterday, and we'd received 113 of those tests back. You'll see that the number of tests that we're receiving coming back is dwindling a little bit every day. We're beginning to catch up on those, so we expect those numbers to do exactly what they're doing. In our inpatient care right now, we have 46. We have 17 at Norton Audubon Hospital. We have 11 at Norton Hospital. We have 10 at Norton Women's and Children's Hospital and 8 at Norton Brownsboro Hospital. Overall, we've tested 2,505 people, and we're waiting results for 240. And as I mentioned earlier, that number continues to dwindle, and hopefully sometime this week we'll be caught up and we'll be able to have a little bit more recent data every day we report around tests. As it relates to employees and employee testing, we've tested 540 employees. We've had 73 of those return positive. That is 3 up from yesterday. And we have 3 employees who are currently in our inpatient care. So as always, let's keep those folks in your thoughts and prayers, as well as all of our patients. The employee health side of things, yesterday we received 226 calls. Those are the ones that were inbound. We're making many, many calls outbound, checking on folks that have furloughs. And I just want to give a shout out again to the good folks who are at that Employee Health Command Center and working those phones. They're doing a great job of not only taking the calls that come in, but making sure that they're reaching out to people who are on furlough. Now, have some patience with us. We still are in the parts of developing this where we get it right from the standpoint of not having many people call you on the same day. But understand, we're very concerned about you when you're on furlough. We want to make sure that we're checking in with you, and hopefully we'll get to the point where it's just the right number of people calling you at the right time. And we don't want to get in the way of your getting better, but we want to make sure that we're staying in contact with you. And they're wonderful people doing a great job, so thanks very much, everybody, for using that. Now, we have 397 people who have been furloughed to this point. And as always, the best news of all is that we have 250 employees who've been on furlough that are now back with us in the workforce. So we're always glad to see that happen. So let's move on then. As I mentioned last week, Friday was payday. It seemed to go well. There were no glitches. It seemed like that we knew that some things were going to happen with some people's coding of payday, but we actually got notification to those folks beforehand. But beyond that, things seemed to go well, and I want to thank you for making sure that your paycheck was right, and if you had a problem, you worked with your leader, you worked with Human Resources. I appreciate your patience if you were one of those. We didn't hear of many of those, which is a very good thing. And I think it's important that I re-stress to you, this is very important to our organization, what we've done for you through the end of this month. As you know, if you're budgeted, we're not requiring you to use your PTO. Obviously, if you're furloughed, you're being paid while you're on furlough. But in that covenant, there's a responsibility on your part to stay ready, because we don't know when this surge could happen. We don't know how big it could be. We don't know what the specific needs could be. But one of the reasons that we're saying, hey, don't use your PTO, we'll make sure you get paid, is because we want you to be on the ready at a moment's notice if something happens that we need to call you back in. So it's very important that you understand that it goes without saying that while you're at home, you do everything you can to stay healthy. You do everything you can to follow the advice of our governor and our mayor when they say, make sure that you don't travel. Make sure that you stay at home. Make sure that you maintain social distancing. Make certain that you don't gather in big crowds. And always, as we know, practice that proper hand hygiene and make sure that you keep yourself healthy during this time, because we need you healthy. We need you ready to go at a moment's notice, as I say. So we appreciate everything that everyone's doing to follow all of these rules and advice that we have now, because it is important that we be ready, and it is important that you be ready at any given time. I always like to make sure that we answer questions that people have. So much has to do with the reporting of numbers that we do on a daily basis. And I'd gotten a question from some folks at Norton Children's Hospital that basically said, are you not reporting the positives from Norton Children's Hospital? Because I rarely see the numbers for Norton Children's Hospital in your numbers that are in inpatient care. And I'm certain that we have patients that are positive within Norton Children's Hospital. And so I wanted to make sure that we answered this question for you today. Understand that we have had a policy of making certain that if any of our patients have symptoms, that we put them in isolation and treat them as if they were a positive COVID patient, even though we haven't had the test results come back yet. That's really the right way to do this, because until we get a test result, there could be a whole lot of exposures take place. So while it may feel like you have a lot of patients that are there in isolation that you think are positive, what we report to you on a daily basis is the number of tests that we've gotten back that are positive and how many of those are in our inpatient care. So I hope that clarifies that. We do have many patients that are in our inpatient care that are in isolation. We just haven't received the test back to verify that they're positive. So again, thank you very much for asking questions. We try to look at those and get some trends that we can answer for you on the video. We certainly appreciate you communicating with us through coronavirusquestions@nortonhealthcare.org. As we close today, we always try to do everything we can to follow the advice of our governor, our mayor, our elected officials. They've done a great job of communicating with us. They've done a great job of checking in with us. They've done a great job of encouraging us. But I wanted to share this tweet today from our governor. I love this idea from Norton Healthcare to send virtual thank you cards to our healthcare workers, the true heroes working the front lines to keep us safe from COVID-19. Thanks, Governor Beshear. We're behind you all the way because at Norton Healthcare, we're going to stay safe and keep the faith. Talk to you tomorrow.